Hello, this is Brandon Leonard, Director of Strategic Initiatives for Men's Health Network, and I'm here at the Dialogue on Men's Health meeting focusing on best practices in men's health outreach. And I'm speaking today here with one of our participants, who's Dr. Sorel Bertrand, Men's Health Program Manager at Whittier Street Health in Roxbury, Massachusetts. And Dr. Bertrand, thank you for joining us.
Thank you for having me here today, and it was a pleasure to be with you today. Thank you.
So I have a few questions. If you can tell us just a little bit about the work that you're doing up in Massachusetts. First of all, can you I know you work a lot with men who have been in prison. Can you talk a little bit about the work that you do and maybe some of the challenges that you face with that particular population?
Yes, as I said earlier during the meeting, our men's health program, we have basically two components. We have a post-prison release. The men, have been in prison, and also the other men they are not involved with prison. They are not part of the post-prison release program because they have been out there for more than a year, for example. Um, Challenges, something when they come out, not only they come out with like chronic diseases many times, but they come out with um, mental health issues, and we have to be there to give them the support they need. Because not only there is a stigma around that population, and when they come out, we really need to help them to find services. This is why we have a comprehensive men's health program designed just for them. When they come out, they meet with us. We help them we connect them with medical services and also with social services. When I say medical services, we make sure they have health insurance. We make sure they have a primary care. They have oral health, eye care, and also if they need behavioral health, as I said before, we connect them with behavioral health services, and also we help them with social services. What I mean by that, social services, we make sure they have, we'll help them to find a job because we help them with also find housing. It's not, we are we are trying to help them to stay healthy, to have a healthy lifestyle. And we help them to have good health because health is not only when they are not sick, but it's the well-being, physical, the mentally, physically, and socially. This is why we try. It's very important for us to help them with medical services and social services. You said challenges. Challenges because sometimes they don't follow up. And this is why we have to um, do case management. That means we have to call them many times. Even we call them, sometimes they don't come to the appointment. That's a challenge because even though we have men's health education, they come to our group. This is where we give them information about health. We let them know that it's very important for them to stay connected, you know, but sometimes they don't follow through. But that's a challenge, and we have to keep trying, contact them, make sure they come and they receive the information we are trying to help to give them, make sure they come and they can, not only get connected with care and follow up with the a job application, for example. Even we are trying to help them to find a job. Sometimes it's hard for them to come back, but we have to keep trying until they come.
Much of today's discussion was about strategies to more effectively reach men with health information, to educate men about their health, and overall to improve the health and well-being of men. Can you talk a little bit more about some of the strategies that you found most useful in your work?
One of the strategies we have been working on is, for example, the men's health education. We have in our program we have three men's health education groups in Haitian Creole because we deal with a Haitian population. We have it in Spanish as well for the Latino, and also we have it in English. This is one of the strategies they talk about today. And also another strategy they talk, I think we will try to use that and use the social media, for example, to get them connected. Because now, everybody's using their phone to do whatever they want. We probably can use that to send them text messages or even get in touch with them, stay in contact with them, and Twitter or Facebook. I think we need to use the technology in order to spread the word, in order to do the job better. I think it's something I learned today. Probably we're gonna use that.
Excellent. And can you tell us a little bit about, in your time doing this work, what are some of the most important lessons that you've learned in terms of working with men, and particularly this population?
Many times we heard and we have seen it that men, they don't like to take care of themselves. But we realize that men don't take care of themselves many times because they don't have information. They don't have enough information. When they receive enough information, they understand what to do. And many of them do the right thing. This is one of the things I learned, that we have to increase the men's health education, because this is key. Because if we want them to do positive changes, we have to keep educating them. And I think this is one thing we have learned, and we'll keep working on that. This is very important. Education is key.
Very good. Well, thank you so much for joining us today for the dialogue discussion, and thank you for taking the time to speak with me as well. We enjoyed having you here.
Thank you very much, and see you next time.
Okay. Thank you.